Good morning, everybody.
Morning, sister.
Sister?
This morning we're going to speak about communicating with the dementia patient. Please remember what I told you yesterday is that this patient needs special understanding in communication. They do not always understand the first time we talk to them. Why it's very important that we manage to speak our patient's language because it's a tool.
Yes.
Yes. And it's also very important that we speak in a language that the patient understands when we're with the patient so that we don't create unnecessary fear
Yes.
with this patient. Please remember, if you're going to talk to a patient, to come down to the patient level, eye contact, and talk to the patient by first calling the patient's name.
Name.
Please touch your patient, not in the face, but on the body. Okay? Please do not touch the patient's faces. You don't like to be touched in the face. Please don't touch your patients in the face. Okay?
Yes.
It's not a nice feeling to be touched in the face. Okay. Remember that body language in these patients especially plays an important role. And a smile is a smile in Afrikaans, it's a smile in English, it's a smile in Zulu, it's a smile in Sotho, it's a smile in German, it's a smile in Spanish. So it doesn't matter what the language your patient speaks. If you touch the patient, you made eye contact, and you called the patient's name and you smile, you've already got a more positive patient. The patient sees you as a potential friend. Please speak slowly to your patients and please speak loud enough. Why?
So they can hear and understand you.
So that they can hear you. They're all elderly. Excuse me, they're a bit hard of hearing. But do not speak so loud that they think you're screaming.
Screaming or shouting, yes.
Okay, all right. If you want the patient to do something, you will repeat yourself more than once for the patient to understand you. Like, Oma, let's go to the toilet. Then you're going to repeat this 3 or 4 times before the patient starts accepting the fact that they are going to the toilet. Okay. You want the patient to know that you are going to the toilet before you reach the toilet. Why? If I get into the toilet with 2 care workers and they take off my pants and I don't understand their intention, I am going to beat them and scream. Okay, so therefore we must make sure all the way to the toilet we explain what is happening now. Please don't get impatient. The minute you get impatient, what happens? No, the patient becomes stubborn. They don't mind. Billy is a good example. If you become impatient, you want to get to the toilet quickly now. She refuses bluntly, and you won't get her to pass urine on that toilet. She will just not pass the urine, or even though she wants to.
Yes.
She won't. You will leave her there, and she will walk to the couch in front and pass urine on that for you. And that's actually your mistake because you were not patient. If you lose your temper with a patient, which is normal because you are also a human being and not an angel when you became a care worker, please ask somebody else to come and help you, to take over. Okay.
Yes.
Don't think you're suddenly going to get this grace on grace. You will need a moment in time to get yourself together. This is a very emotional job. It's emotionally straining to work with the elderly and especially to work with the dementia patient because they can also say things to you that you might find hurting, but which you please mustn't take upstairs.
Yes.
Okay.
Yes,
Please
sister.
remember that the patient doesn't mean to be mean.
Yes.
They want to be kind to you as well. It's very easy for me also to see when a care worker is a good care worker. How do I see that? My patients
My patients
respond to
respond.
you or her in a certain fashion. They gravitate to the patients that is, or to the care workers that is kind and loving and patient. While the care worker that's all business, let's do the blood pressure, let's put on the clothes, let's do this and do that, and they look very busy and they look very effective, but they are useless.
Yes.
They are totally useless. They can work very hard.
Yes.
I mean, but they're not working for these babies. No. Please remember, don't do everything for your patient. Yeah?
Yes.
No? The patient must be able to do things for himself, like brush his teeth and eating and put him on their shoes. But remember, these patients are mentally declining. So don't give all the clothes to the patient. Because do you know that Superman, he's got dementia. He puts on the pants first and then he puts his underpants on top. Haven't you seen that? So sometimes if you give all the clothes to the patient, you'll see a couple of Supermans walking up. Okay, so you give, if you want the patient to dress, you give underwear first, then you give the pants, then you give the shirt, then you give the socks, then you give the shoes. Don't give all the clothes at once, you are confusing them.
Yes.
And if you confuse them, the time it takes for you to dress this patient is going to be long.
Long.
Even if you work with a dementia patient at home, it's very important not to disrupt their routine. They must wake up at a certain time, wash at a certain time, eat at a certain time, go to bed at a certain time. It's called routine. If you have children, you've got the same problem there. And with the difference in the dementia patient, if they normally shower in the morning and you skip that shower, and you try and shower them this afternoon, how's that shower going to go?
Not gonna go well.
Not at all, because they've showered this morning. Is it going to help you to tell them that they didn't shower this morning? Not at all. What is going to happen if you disagree with the dementia patient?
Gonna be aggressive or something.
They're going to become aggressive. So there's a word we do not use in dementia care, and that word is
No.
no. Please don't use the word no. Okay, because that might earn you a beating. And I'm not going to feel sorry for you, because I'm training you to nurse these babies the right way. If Joan starts packing the glasses on the table, do you take it away?
No.
Why not? Because she's now touching the glasses and you've put them in rows, 4 by 4, and now she's messing your business. If they don't hurt anybody or themselves, we do not stop them from an activity. If they're not going to break something, they're not going to injure themselves or another patient, you leave them. Just leave them, they are happily employed. Okay.
Yes.
You give patient a cloth and they start wiping the table, and they wipe the table from breakfast to tea. It is fine. You understand? There is no problem with the patient doing this task. If the patient crawls on the floor, must I pick him up?
No.
Because the patient wants to crawl on the floor and the patient is happy. And it's all about the patient's happiness here. Because if the patient is happy, you are happy. I'm serious. If the patient is happy, you are happy. If the patient stands up from the chair and then you push him back,
No.
why not?
You took him of a walk or something.
Yeah, please do not do that. Like, here we go. Good example. Please do not push patients back in chairs when they want to get out. Okay, we also need to remember, what do I always tell you, what is the main emotional condition of these patients?
And then we leave it to the day.
Fear. They are scared. Nah? They are scared, and the other thing is deprivation. The word deprivation means to be everything being taken away. Yeah. So remember, their houses have been taken away, their children have been taken away, their husbands and wives have been taken away. Their beautiful house with all the little thingies in there has been taken away, their cars has been taken away. And like I always say, by the time they come to us, the suitcase they arrive with, they didn't even pack. Somebody else decided for them what is coming to us with them. So mostly they have got absolutely nothing that they want. Okay.
Ja.
Ja. Tenminste jy wil.
Waar gaan ons nou wees?
So take that into consideration and don't expect your patient to be thankful. If you lose everything in your life
Kom help
and
my.
suddenly somebody wipes your bum,
Waar is die lank?
then I don't think you're going to think you've got something to be thankful for. Yeah, I do think so. So don't expect them to be thankful. Although they are always very kind and very loving and very thankful towards care workers that care. Yeah.
Yes.
Okay, listen, don't make a lot of noise, né? You know. Okay, that's all basically. Just remember to talk to your patient, touch your patient, né? By touching your patient and coming to eye level and using a tone of voice that's friendly, né? And repeating yourself. If a patient stops talking, like Oma Frida here, do we stop talking too? No, because we've got brains left. We continue talking. Do I talk to her in a different manner than I talk to Joan or to Tanny Mori? Do I? No. No. Please don't do that. Don't do that. Talk to them normally. Don't, because they know when they also become very, very angry if they think you think they're stupid. And they also get very, very angry if a group of care workers starts laughing and they don't know why. Because they think you're laughing at them. Okay. Thank you very much.
Thank you, sister.